Hi, I'm Dr. Michael Calderwood, Chief Quality Officer at Dartmouth Hitchcock Medical Center. I'm here today to talk about our announcement that Dartmouth Health as a system will be moving to make masking optional coming into our healthcare facilities on Monday, April 10th. I want to talk to you a little bit about the decision behind this move. 3 years ago, in April of 2020, we moved, like many healthcare facilities across the United States, to begin having employees, patients, and visitors wear masks coming into our facilities in order to prevent the transmission of COVID-19. We actually know that this prevented a huge number of cases within the community and helped to keep our patients and our staff safe. We are at a much different time now than we were 3 years ago, or even where we were a year ago. If you recall, in the spring of 2020, as we began to introduce masks into our healthcare facilities, we were having schools and businesses close as a mitigation. We didn't yet have vaccines. We didn't have all of the incredible therapies that we now have that have made recovery from this virus much more likely today than it was 3 years ago. As we look at the past year, comparing this winter with last winter, we've seen a 72% decline in hospitalizations across the United States. Compared to the prior 2 years, we've seen a 75 to 82% decline in deaths this winter. It's related to many things. One is that we have data now that over 90% of the US population has some degree of immunity to this virus, both from widespread vaccination and from prior exposure to the virus for those who've had breakthrough infections, thankfully in many cases, or most cases, quite mild in those who are vaccinated. Where we are right now is that across northern New England and across the United States, we are seeing communities reduce their transmission as shown on the CDC maps for community levels and community transmission. And here in northern New England, in New Hampshire and Vermont, our communities are at a level where we can begin to follow CDC guidance about making masking optional for those who are asymptomatic and coming into a Dartmouth Health facility. There's a lot to celebrate in this. Again, we have been through a long 3 years. We have seen an impact from this virus that has affected our healthcare facilities, our patients, our communities. We've seen numbers in terms of deaths and disability that are astronomical. And I don't want to minimize any of that, but I do want to give a little bit of hope and to say that we thankfully are seeing a much different landscape, that we have vaccines and we have therapies that we did not have 3 years ago. And we are beginning to see the impact of those that has allowed us to reopen our schools, our businesses, to begin travel and gathering and vacations and all of the things that help us to connect. I recognize that this announcement comes with some trepidation for some. There are many who, because of illness of their own or worry because of the lower immunity of those in their household, may want to continue wearing masks, and we welcome that. Anyone coming into our facility is welcome to wear a mask, a KN95, an N95 respirator to provide a level of protection to themselves. We also ask that individuals practice mask mirroring. If those who you're around ask for you to wear a mask to help provide additional protection, that is something we've learned to do. We can easily show that courtesy, don the mask, and help them to make sure that they are feeling comfortable, both here in our healthcare facilities, but also out in the community. Again, change is hard, but again, I am very excited about this announcement and what this means about where we are today and where we are heading in the future. Thank you very much.